Welcome everyone to the Appropriations and Financial Affairs Committee. This is a 2 o'clock meeting with our fellow colleagues on the Health and Human Services Committee. They're doing a report back from the biennial budget. We're delighted that a portion of their committee is joining us today. I'm Teresa Peirce, House Chair of the AFA Committee, and I think I'll start with Senator Claxton or Chair Meyer. Would you like to introduce your committee members that are here?
Sure. Let's start with Representative Javner.
Good afternoon, everyone. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington County.
And Representative Griffin.
Good afternoon. My name is Abigail Griffin, and I represent House District 102, which is Glenburn, Levant, and Cadescate.
Senator Moore.
Good afternoon. My name is Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Good afternoon. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott and parts of South Berwick and Kittery.
Thank you, Madam Chair. I'm Ned Claxton, and I represent Senate District 20, which includes Auburn, Minot, Mechanic Falls, Poland, and New Gloucester.
Thank you so much. Welcome to today, and we're delighted to have you here. I'll start with introductions on the AFA committee now, and I'll start with Representative Fecteau. Are you great?
Good afternoon, Justin Fecteau. I represent House District 86, which is part of Augusta.
Thank you. And Representative Arata.
Good afternoon. My name is Amy Arata, and I represent House District 65, which includes New Gloucester and part of Poland.
Representative Hymanson.
Hello, good afternoon. I'm Patty Hymanson. I represent House District 4, which is parts of York, Wells, Sanford, and all of Ogunquit.
Representative Corey.
Good afternoon. I'm Patrick Corey, represent House District 25, which is part of Windham.
Representative Fay.
Good afternoon. I'm Jessica Fay. I represent House District 66, which is parts of the towns of Casco, Poland, and Raymond.
Representative Millett.
Good afternoon. I'm Sowen Millett. I represent House District 71, including the citizens of Norway, Sweden, Waterford, and West Paris.
Senator Davis.
Good afternoon. My name is Paul Davis, and I represent Senate District 4, which is all of Piscataquis County, parts of Somerset, and Penobscot. Thank you.
Senator Bailey, excuse me.
Thank you, Madam Chair. My name is Donna Bailey, and I proudly serve the residents of Saco, Old Orchard Beach, Hollis, Leamington, and part of Buxton in the Senate.
I think that.
Hold on, let me mute some people here. Thank you. And my good co-chair, Senator Breen.
Good afternoon. I'm Kathy Breen. I represent 6.5 communities in Cumberland County, and I serve as Senate Chair of Appropriations.
And once again, I'm Teresa Peirce. I'm the House Chair of Appropriations, and I represent District 44, which is the majority of Falmouth. We have a few members who are doing work sessions and presenting bills at other committees, so people may come and go. As we all know, that happens around the horseshoe. But we're delighted again to have Senator Claxton.
Thank you, Madam Chair. I just feel it's important to recognize our two analysts are here, Aaron Dooling and Anna Broom, and our fiscal analyst, Luke Lazur, who helped make our work possible.
Excellent. None of us could do this without the people behind the scenes, and ours include Maureen Dawson and Marianne McMasters, who's running the board today. So we're excited and happy to have you all here for this report back of your portion of the biennial budget. I think we'll turn it over to your committee, and then we'll field questions maybe at the end of your presentation. That seems to be the way we've been organizing ourselves for these report backs, if that works to your pleasure.
Whatever works for the committee.
Great.
That's fine by us. You should have gotten a several page note that was put together by our analysts. And I think the thing I'd highlight first is the unanimous votes on page 1 that would oppose eliminating the direct cost share claims on nursing home hold beds and on the 340B providers. None of the committee or the committee did not feel that now is the time to do anything to organizations that had already suffered a lot through the COVID pandemic, so that nursing homes and hospitals sort of had a protected status in the current circumstances while we shook things out. So that's why we turned both of those initiatives aside. On page 2, we approved 2 proposed initiatives. We opposed 2 initiatives, one of which would have dropped the dispensing fee paid to rural pharmacies, and the other which would have decreased all of main care prescription drug dispensing fees. Again, for the reason that a lot of our smaller pharmacies, especially rural, were vulnerable in the current circumstances and had no opportunity to plan for this. And that the decrease of 10% could significantly negatively impact them. We also opposed some mental health changes that would change the reimbursement plans for Spring Harbor and Acadia from the current 117% of costs to 100%. We thought it important to honor previously negotiated contracts and understandings that allowed those organizations to take some of our most challenging patients. And it was that similar thinking that got us to turn away the changes in psychiatric discharge rates for Northern Maine Medical Center and St. Mary's. Same issue, limited number of pediatric beds available already, and to have a change in discharge rates for organizations that were also part of the group that's vulnerable didn't seem to make sense to the committee, especially in the setting of lots of long wait lists and increased demand because of the pandemic.
Could I ask a question?
Sure.
Could you tell us, Senator, which colored documents you're working from?
I'm sorry. I'm sorry.
And could you use page numbers and so on so we can follow along a little bit more intelligently?
I'm challenged a little bit, Representative Millett, and then I'm only working off the letter right now. I wanted to give people a high-level summary. So I'm working off the letter that's dated March 19th. And it was written in anticipation of the budget work. So I don't have, I can refer to lines, and I'd be glad to go back over what I mentioned before and flag lines, but I think that puts you in the green papers, right?
I think it would, but I think he's just reading from the paragraphs on the cover memo at the moment.
I thought I'd start
I
there.
hope that I was there too, Senator and Representative First, but I couldn't find page numbers and I was getting lost very quickly. So I appreciate, Senator, you know your stuff. Just dumb it down, slow it down, and we'll try to follow.
And I have to acknowledge that you know your stuff, and I wasn't adhering to what works best for you, and I recognize that. The first things were line 385 and to 387, and that's where we protected the bed hold days compensation. Line 385 and 387. I don't have the page number for that.
So he's on the first sheet of the report back and sort of the first paragraph of
I've gone back to make sure that you have the line numbers, and maybe Luke Lazur can do that off the top of his head. Maybe he knows which page those are on. And then the
page 26.
Senator Claxton.
Yes.
So 385 to 380, lines 385 to 387 are on page 25 of the green document.
Okay. So maybe since we're jumping back and forth, maybe we want to go paragraph by paragraph.
So to that end, 347 and 349 are on page 22 of the green document.
So I will do it whatever way works best for the committee.
Typically what we do is run through your cover memo, and embedded in the paragraphs within the cover memo are the pages that are the lines, of the document. So if anytime we can cross-reference it to the green, I think that might be most useful. But I think staying with your cover document right now would have people floating through less paper right now as you kind of overview it. And then maybe as we go into questions in more detail, we might be able to reference the green pages when appropriate.
Very good. And I'll defer to my chair in terms of finding the locations for lines 364 to 466, which was the rural pharmacy fees we talked about, and also 367 to 369.
Page 24 of the green document.
Which would decrease the compensation to for all main care drug dispensing. And I also
Senator Breen has her hand up. So Senator Breen.
Sorry to interrupt. I would like to suggest that we stay on one document at a time and that we finish the memo.
Yep.
And have that overview. And then if it's okay with other folks, we can get out the color documents and walk through those in a more detailed fashion after that. Would that work for folks?
I kind of thought that's what I said, but maybe that's not what came across. So
no, that's what you did say, and I went too fast and I didn't reference pages, which would have been helpful for those who wanted to keep up.
And so right now, I think it'd be helpful just to say exactly where you're going to start from.
Okay. I'm on the second page of the memo. White pages, the memo dated 3/19. I'm on the middle of the second page.
And the paragraph that starts with
the committee voted unanimously.
That's a lot of those paragraphs. Luckily for us, you voted unanimously quite a bit. Is it the one for the supplemental payments to hospitals?
That's the one.
Great. Is everybody with us on the committee where we are? I've seen some heads and thumbs up. Excellent. Away we go.
Okay. So that was a supplemental payment to hospitals that we increased by over 500,000. The committee unanimously voted to support the initiative related to the hospital taxes in lines 308 to 9 and increased the supplemental payments to hospitals to prevent any shortfalls. This was part of the protected status for hospitals, pharmacies, nursing homes that we were trying to recognize. In the next paragraph, I referenced divided votes on initiatives proposed in the budget. And these were on party lines and related to consolidation of the main care programs and accounts. So this is extensive and involves multiple different lines, multiple different pages, and language part SS.
So I think we all are with you on the paragraphs. Is there an overview you could give us on these paragraphs and then we can dive in?
Sure. On this particular one, we were concerned that we might lose the ability to track spending in program by program, and that the roll-ups might obscure initiatives or make it harder for us to track progress in various elements of the main care work. They were doing it, they wanted to roll up into 4 accounts from 13 for accounting purposes and simplicity. It also enabled that and allowed them to decrease residual balances in some of the accounts when they rolled them all up together, and they were looking to mobilize some of that money.
Okay.
We were, the majority was concerned about loss of transparency. But we were reassured that by Luke that was still a trackable entity, but we weren't comfortable with it.
And this is part SS, these comments that relate to this. Great.
Yes.
And then the next paragraph talks a lot about CCC, TANF, different parts of language.
If it starts the paragraph, the committee is divided on all language initiatives that lapse unencumbered balances.
Correct, yeah.
We've crossed that out on our version.
Okay.
On the most recent version, that whole paragraph is crossed out. That ends with "this language is attached."
It was crossed off because it was included with the supplement, the back to the basics budget or whatever we're calling it. So it's already included, 715.
Thank you.
Thank you for that clarification, Senator. That's old news.
Mm-hmm.
The next paragraph related to new positions. There was a divided report on moving positions to the general fund within the CDC, as well as the Health Environmental Testing Lab and the Health Inspection Program. These changes appear on multiple lines too. The majority voted to approve the initiatives, which were basically an expansion of CDC to do some of the work that it wasn't able to fully do, and to bring those positions into the portion of the department where they belonged. This was partly building out the health lab and expanding resources for their health inspection program.
Thank you.
On the top of the third page, it begins "the minority voted against them." And the next sentence, in addition, through the next 3 sentences, is crossed out. I'm sorry you don't have a current copy of that.
And you're on the top of page 3 of your memo,
Right.
and you're starting with the paragraph. The committee is divided on the initiated in lines 216 through 217.
Okay, so there was some language before that that apparently got pushed down. Well, I'm not sure. What I'm looking at is the bottom of that previous paragraph we were looking at. That ends the minority voted against them. We then crossed out the next 3 sentences and kept the notation that all votes on these lines were on partisan lines. This was included already in the lead positions were already included in LD 714, but only for the biennium.
715.
I'm sorry, 715. Thank you.
Okay. So now we're going to talk about language part R.
Yes. And that was related to bringing a senior legal advisor into Department of Health and Human Services. The majority supported that idea with the blessing of the Attorney General, and the minority voted against that proposal.
You can, I think we just continue on down and.
Okay. And the next part, next paragraph relates to a language in part WW that authorize the department to adopt emergency rules to implement provisions of the budget. The majority voted to approve and the minority against on partisan lines. Partly, this language has subsequently been included in the budget, but could show up again in a supplemental. Then we went to the language of part NN that would have allowed for unspent funds for public health nurses to be transferred or repurposed, and requested that language be repealed. The majority voted to approve the language changes and the minority against.
Okay.
The next paragraph speaks to language part QQ, which changed the frequency of life safety inspections from annual to every 2 years. That was a 12-to-1 vote. This reflects the inspection requirements for nursing facilities. And the every year, as long as they were already getting inspected by Medicare, it's created lots of work, and it didn't cycle well with the Medicare inspection process cycle. So we voted to spread it out a little bit since Medicare was still going to be there on a very regular basis.
And that was a 12-to-1 vote?
Yes.
Maybe we could stop right there since we're going to move to the Fund for Healthy Maine, and that might give an opportunity for people that might have specific questions around some of these areas. If not, always time later too to ask your question if nobody has anything right now. Not seeing any hands go up or anybody waving at me. So why don't we continue on, Senator? Thank you. Oh, I'm sorry. Patrick Corey has his hand up. Representative Corey?
Sorry about that. Just the one that we just covered real quick on Part NN. I was curious why there were unspent funds for the public nurses, and if they are going to transfer those or repurpose that money, how are they proposing doing that? Like, I guess I could try to have Part NN in front of me, but I don't have my big binder. But could somebody explain that?
I think the intent was to allow them some flexibility in where any unspent monies could be redirected if they were understaffed, if they were missing nurses, then maybe that money could be better directed to other efforts. That's my recollection of that, but I would defer to my colleagues.
So this is like money going forward. This isn't in the past.
No,
that they weren't spending the number of funds. This is just in case in the future they have, and then they're just looking for discretion then in how to spend those funds.
That's right.
Okay.
This is only for appropriated or allocated funds and the public health nurses and the services they provide. So it's not, there wasn't a pile of money sitting around that they wanted to carry forward.
Representative Millett, did you have a question?
Comment, Chairperson, Chair Claxton. This is much more orderly than the way we get started. I'm wondering why we don't have the revised white sheets with the page numbers with the LD 715 pieces stricken out. Maybe I'm the only one, but I'm still working from an original where I tried to mark up those that I found in the abbreviated green sheets had already been taken away, but I'm not looking at the same paperwork that the committee members are, apparently. Am I the only one?
So I believe everyone on our committee and on HHF received a revised green sheet that made sure that things were
I have the revised green sheet. Yeah. I don't have the revised white sheets.
I did not receive a revised memo unless I missed that in some communication. Did anyone else? No, we don't. No one else has a revised memo. I think I think Senator Claxton, you were just walking us through and telling us what to strike, correct?
Yes. Yes.
Yeah.
I no longer feel alone.
Yeah, please don't feel alone. No, we're all in this together. So, but you do have a revised green sheets.
Mine has red things crossed out. So I'm sorry you don't have a current copy. That would make it a little bit easier.
But I feel like I see that Maureen has popped her head into our Zoom. That might be helpful. She always has good information for us.
Well, I don't, but Anna just sent me that one with the strikeouts, and I just sent it to the entire AFA committee. So you should be getting that in your email like now.
So that'll be something we can print off maybe for.
You can, yeah, or look at it somewhere on screen or.
Okay, thank you for that.
No, thank Anna.
Anna, thank you, Anna. So why don't we move ahead with the Fund for Healthy Maine?
Okay. So there were two initiatives in the Fund for Healthy Maine. One was to allocate monies to establish the Office of Health Equity, and the other was to fund the overdose prevention through intensive outreach, naloxone, and safety program known as Options. So there was money coming out of the Fund for Healthy Maine that would fund those two efforts.
Okay.
And we also voted a new initiative. That was the $5 million of the Fund for Healthy Maine to be committed to tobacco prevention and cessation interventions. We felt we wanted to make sure that those funds were designated for the purpose for which they were intended, and to avoid their going to anything else, at least that 5 million in each year. We've also heard lots about vaping and the increase in smoking, and we felt that it was important to have resources to fight that.
Great.
It was also part of the master settlement agreement, and we didn't feel we could go too far off the ranch and stay adherent to that.
Wonderful. Should we move ahead with child protective caseworkers?
That's right. Child protective caseworkers and the alternative response program. This engendered lots of conversation, and it reflects the department's commitment to move ahead with, Representative Arata, do you have a question for me?
Yes, thank you. I didn't get my virtual hand up very quickly. I apologize. I was wondering in the discussion about smoking, was marijuana mentioned at all? Because any type of smoke causes lung damage, and a lot of people are now smoking marijuana since it's mostly legal. Was that discussed at all?
I think there was a few references in passing, but the major focus was on the long-term hit from cigarette use and the long-term implications of vaping when you're 12 years old. And
Okay,
less about
I
the
remember health class when I was 9th grade, we were told that smoking a joint was like a pack of cigarettes. I don't know if that's true or not, but it scared me enough that I won't touch the stuff. So, I mean, maybe that's something to consider with Fund for Healthy Maine.
So, Representative Arata, just so people know, on the committee, 6% of the money that we collect through marijuana goes into, or 12% of it goes into a public health and public safety fund. And it's about this very thing, helping kids understand why they shouldn't be doing it. And if you're over 21, helping you understand what the effects might be so that you have some good information around that. So there is a fund set up that addresses these issues, but it's separate from the Fund for Healthy Maine.
I see. Thank you for the clarification.
Sure. Representative Corey?
Thank you, Madam Chair. I was actually going to say that as well, but I think we're going to have to fight like hell in the future to make sure that nobody raids that fund that we created through the marijuana program for other things. So
right. Great. So I guess we can continue on with the protective caseworkers.
As I was explaining, the issue about caseworkers and the alternative response program is that the department, the Office of Child and Family Services is committed to rolling out what's called the Family First Act. It's a much longer name than that, but it's the Family First Act. If we can meet the stipulations of the federal government, that opens us up to access to many more dollars that are better used or better focused towards the needs on this of the kids that they deal with. And this would expand home-based care, it would expand residential care. And this was a transition process. Their intent was to hire 15 new child protective caseworkers, and they were going to do that on January 1st. In the meantime, they were going to let lapse a contract with the Alternative Response Program, which did some of the same work, but not exactly the same thing, and was much more based in the community. The committee was concerned that there wasn't an adequate transition process from one to the other. So with working with the department, we agreed that they would be hiring their 15 caseworkers by October 1st and would overlap with the 30 alternative response program people who were employed by contract until the end of the calendar year. The concern was that as soon as the ARP folks realized that their jobs were going away, they would be moving on and looking for other employment, and that we might not have the resources we needed to get us to December. And then there was a training need starting January 1st to get those people up to speed. So now they've started to identify those, they've committed to identifying those folks and getting them hired as close to October 1st as possible as the next major step in terms of taking care of our at-risk kids for abuse.
Excellent, thank you. Any questions on that section for members of the committee? I'm seeing none, so we'll forge ahead.
So to further backstop that transition, and given the possibility that were not able, the department or the office wasn't able to hire the child protective workers they needed, there was discussion about putting in place an alternative plan that would continue the funding for the alternative response program through March of next year if they hadn't hired enough child protective workers. There are openings now in child protective work, and there's openings in the alternative response program. So a number of us were concerned about the kids getting the support and supervision that they needed. And so the trigger was if they have not hired 10 of the 15 people by October 31st, then the alternative response program would be extended until the end of March.
Okay.
And that vote was 9-4, with one person crossing partisan lines.
Thank you. Any
Okay.
questions on that from committee members? Thank you. No questions right now. We'll forge ahead.
Okay. There were then a number of technical corrections. One is to make the main care estate recovery rules match the mandatory federal requirements. That one was easy. There was an additional initiative to establish a public health nursing consultant position in the DHHS to support the work of the Mortality Review Committee to investigate deaths of individuals receiving home and community-based services under a main care waiver. This position was included in LD 1377 and 2126 in the 129th, but died on the table. So this just fills out the staffing of what we regarded as a very important review process to look at mortality related to home-based care and community-based care.
And you have in here a reference to identical proposal in LD 716. Can you enlighten me as to what LD 716 is? Or is it supposed to be 715?
I will defer to, I will scramble to ask Aaron or Anna to help clarify that.
Thank you.
LD 716 is Representative Madigan's bill that creates the Mortality Review Board, and they just voted unanimously to support that this week.
Ah, thank you.
Thank you for that. We'll need to go to judiciary for a public records exception, and that's scheduled for next Tuesday because it requires sharing some information that needs to be vetted.
Thank you.
And then we skip to a paragraph that on my sheet begins divided votes on new initiatives. And the previous paragraph is crossed out.
And that's because it was in LD 715.
Yes.
Thank you.
So we also voted divided on an initiative that would restore the threshold for general assistance funding to what it was in 2015 with the current reimbursement rate is 70% up to a threshold of 0.0003 of the municipality's most recent state valuation. And that would trigger reimbursement at 90%. The argument being that the major service centers, Bangor, Lewiston, Auburn, Portland, for instance, were where folks with high GA needs tended to aggregate, and that they should get some support for taking on the role of supporting those people. And so this was the way that that was engineered.
Thank you. Looks like that concludes your review of the memo. I'll just open up for questions again on the memo, and then we can also start looking at the green sheets if that's the pleasure of the committee. So, Senator Breen.
Thank you, Madam Chair. Just back to tobacco cessation for a minute and the Fund for Healthy Maine. I have never been able to find a document that defines in legal terms what those monies are supposed to be used for. So if that exists and you're referencing that as a basis for that recommendation, if you could get it to me, or if your analyst could get it to me, that would be great.
I know people who can do that.
Thank you.
Did the entire committee get it as well?
At least the summary document would be helpful. I don't think you need the whole master agreement between the tobacco companies and the states. Just the salient points.
Yeah, it'd be great if the entire committee could have at least the link on it for sure.
I'll leave it to Anna or Aaron to tell me that they can't do that, but I trust they can.
Perfect, thank you. Any other, oh yeah, Representative Hymanson? Oh, I'm sorry, Anna?
No, we can't do that actually.
Oh.
But you could certainly ask the Attorney General's office if they'd like to weigh in on what, I mean, they're the keepers of the Master Settlement Agreement as far as we're concerned, but this is something that comes from the advocates, not from us.
Right, but there is also some printed material I think I remember about what was the breadth of what could be covered by the Fund for Healthy Maine. There's at least some language that speaks to that.
Ms. Dooley?
Yeah, hi, yes. We can send you what the statutory section outlines as available uses of the Fund for Healthy Maine, but the legislature has the authority to spend Fund for Healthy Maine dollars on anything that it wants, regardless of what it says in the statute, because the statute cannot bind the legislature, only the Constitution can bind the legislature. And so just because those uses are listed in the statute does not mean you are limited to those.
So, Ms. Dooley, do you think that we could inquire with the Attorney General to get us the one-page summary of the summary of the settlement, so that we could have more detail around the settlement?
Sure, that would be fine. And Luke put together a presentation on Fund for Healthy Maine earlier this year as well that we can provide to you.
Oh, that would be very helpful. Does that help you, Senator Breen?
Yes, thank you.
Perfect. Thank you. Any other questions right now from the committee members? Seeing none. Well, it was a very lengthy memo that you went through, so I appreciate it. I want to definitely call our attention to the other papers that you provided. One of them is a green sheet that was updated with what was in LD 715. And then there is also a pink document, and that is the I might ask Luke or you to describe what's in all of these documents so that we're familiar with the paper in front of us. And then we also have the purple document.
So Representative Purse, I can give you just a quick outline of that. This is Luke Lazor from the Office of Fiscal Program Review.
Thank you.
So the multiple larger documents you have, the pink document was an outline of what all the baselines were that were part of the budget. Now that LD 715 has passed, that entire pink document is no longer really useful to the committee because that's all been voted in already. It was part of the budget you passed. The green document is the document that outlines all the initiatives that are in the Part A of what was originally the proposed budget. There is a document that I provided to you yesterday, I believe, that has the more updated green document where I removed anything that was included in LD 715. And additionally, there were a number of lines where only 1 year was included in LD 715. So those lines are still there, but with the funding that was in the first year removed. So that green document has only been provided to the AFA committee. I did not provide that to the HHS committee since it's sort of out of their hands at this point. I only provided that to the AFA committee.
And Luke, that is dated 4/5/21 at the bottom, correct?
Correct.
Okay,
yes.
Great. Thank you.
And then the last document, the purple document, is all the language that was in the budget. Now I should note, I do have, since yesterday, I've updated the purple document as well to remove. There were a number of items in LD 715 that were also language pieces. I think there were 4 or 5. So I have removed those as well, but I did not provide that to the committee yet. I just didn't have it complete yesterday when I was doing my work. So I will be providing that to the AFA committee as well.
Thank you so much. I appreciate that. Representative Hymanson.
Yes, thank you. Hi, Luke. Nice to see you. Nice to see everybody in HHS. Can you just review again what's the single year funding that you removed on the green document?
There are a number of lines that were funding for a few different rate increases that are included, and they only, in LD 715, it only included the first year of funding. Right off the top of my head, I don't have what all those lines are. I've been sort of scrambling to get these documents together as it was, but I'm sure if I could outline that for you separately.
That would be great. If you could do that, I'd appreciate that. Thank you.
You're welcome.
So it sounds like Luke will be providing us with updated documents that reflect the changes from LD 715 if they haven't been already. And then happily we'll go through it with any of us who need that later on. Is everyone on AFA familiar with what's in front of them now with the documents? Seeing some head nods. Yes. Great. Are there any other questions from the report back? You can get into specific line numbers should you choose on the green document or the purple as well. If we have any other questions of the HHS committee from this report back. And Representative Hymanson, your hand is up just from the last question. Yes? Yeah. Oh, thank you. There we go. Great. Oh, Senator or Representative Millett.
Thank you, Madam Chair. I think the questions I would have, first of all, would be if staff could prepare, and maybe Luke is already doing this, a summary of the expenditures with what's in 715 and what are the new initiatives recommended in the report back, how they compare to the original budget asks in LD 220. And also, I think it would be nice to have some indication of the status of the main care stabilization fund and the transfers that were originally proposed to go into it, and the 78 million that we took in this shell budget last week, which has already been utilized. And I was under the impression, perhaps incorrectly, but I know Luke is on top of this, that there would be a need to have some sort of a main care stabilization fund in the event that Medicaid expansion overran the parameters that were in the previous biennial budget, the current years. And I've heard nothing about that. So I'm just kind of wondering, at some point, has the committee been updated on the status of main care expenditures, both in terms of members and utilization? And do you feel that having taken the 60 million from main care and the 10 from TANF and the 8 from Aspire and the 3 from GA, that those accounts are okay for the biennium without being transferred into a stabilization fund? I just have heard nothing about that since the original hearings and what I thought I remembered from way back at the supplemental time.
So Representative, there was a lot in there. I'll turn it to the chairs of HHS to answer the latter question about any concerns that they have. And Luke, are you comfortable with what you heard from the good representative about the questions he has?
I'm comfortable, yes.
Okay, great.
And are you then comfortable too, Luke, with that the last question being adequacy of the main care stabilization fund under the current circumstances?
To the main care stabilization fund, what I would note is that there's been no specific information, I think, provided to the HHS committee that you, the AFA committee, have not also received, because most of the information around main care spending is the information that I send to you as often as I get it. So I've outlined sort of where the spending has been. One of the pieces that I include in my quarterly report that I do is the total main care spending and the total spending on Medicaid expansion specifically. And what I've noted in that so far is that the funding that was required for Medicaid expansion has been below what was the original appropriations in the last biennial budget for Medicaid expansion. So I think, Representative Millett, to your specific question, so far the spending has been below the level that was appropriated. So there really is no need to take any of the funding out of that main care stabilization fund.
Senator Breen, did you have a comment or question? Oh, I'm sorry, Representative Millett, did you want to follow that up?
Only to say briefly, Chairperson, thank you to Luke, because I rely on him, and I've often asked this question of Maureen, and I know that the answers are available in OFPR. We were originally going to transfer 14.5 out of that fund in the supplemental toward the Fund for Healthy Maine. We didn't do that. Similarly, in the supplemental, we were to ask to restore 25.5 million to the Medicaid expansion or Medicaid stabilization fund. Neither did we do that. And I'm just curious as to the 78 million in those 4 accounts that lapsed and which were included in LD 715 last week. Does that taking reflect that the 78 million in those 4 programs is needed in 22-23 because of the ability to lapse those fairly large balances? So it's a question that I could pursue, Chairperson, in work session, but I'm really going to be asking Luke to keep us informed about the status of the stabilization fund and obviously updating us as often as possible on the cost of Medicaid expansion. So I'm okay for right now. I just want to keep on top of the issue.
Great. I might go to Senator Breen, who's had her hand up, and then Representative Javner.
Thank you, Madam Chair. I think we could certainly get a summary from OFPR on the status of the 2 stabilization funds. I think that if the department feels that we need to attend in particular to the main care stabilization fund, that will be in a change package that comes forward after the May revenue report. So I think I would look to Luke to summarize the recent transfers in and out. And then I would pause there and then see what the, if we, we could easily suggest maybe our own committee would like to see more into that stabilization fund. But I would not ask Luke for anything other than the status of those funds.
Correct. Representative Javner?
Thank you, Representative Peirce, and thank you, Senator Coxton, for presenting so well our report back. I know we've been looking forward to this interaction with the AFA today, and I just want to mention just a couple things, if I may. I'm thankful to Representative Millett, who has brought up, the lapsed funding with the whole GA situation. Even, the minority, we may have voted against the 90%. But, there were some really critical pieces that were brought up in our discussion for GA. Even, we lapsed $3 million from that account. But if Luke, you can correct me if I'm wrong. I remember that there was like 14 million in that account. And so I just have, it just, from my perspective, it brings up more questions than answers. And I think if we would have been able to have this conversation prior to the voting of LD 715, that we could have perhaps even answered that question of funding 90% of GA if there was already the funding there. There's an amount there. Also, I have a question, if I may, to maybe members of the AFA, since I want to go to the Office of Health Equity that we were voting on in one of our lines here. I just recently learned this week that that's actually now going to be funded through the rescue funds. And I'm looking to know exactly what the amount is that is going to be funded at through those funds, and who is making the decision now to utilize those funds to support this Office of Health Equity. I'm wondering if anybody has those.
So are you referring to the American Rescue Plan funds?
Yes, excuse me, the American Rescue
Sure.
Act. Yes.
So, I think what I'll share with you is that we have not received guidance from the federal government on how we exactly can expend those funds at the moment. We're waiting on that. They indicated that we might be receiving guidance around the 12th or 15th of April, but we clearly haven't seen anything yet. And to my knowledge, we have not decided how to spend any of those funds at all because we're waiting for that guidance. I think what happened under the CARES Act was there was guidance, and then the guidance changed and it got very complicated. So we're really waiting for a lot of clarity before anything would be expended out of those funds. And we also put in the supplemental the ability for the legislature to have a discussion about how we might spend that funding. So certainly there's nothing that's come out of our committee that's done anything in that manner. So I'm not sure where that information is coming from, but it's not from our committee. And certainly I haven't heard that from the administration or anyone else. In fact, the administration is very clear about wanting to wait for the guidance from the federal government before they make any decision about how they might think about allocating that money, and then how we're going to participate with us about how we do that. Does that help with that? Yeah. Representative Arata? Oh, I'm sorry. Representative Javner, were you done? I'm sorry. My apologies.
Yeah, thank you. Thank you, Representative Peirce.
Sure. Representative Arata?
Thank you, Madam Chair. I was looking at the two different green sheets from one from March, one from April, comparing the bottom line and looking at the general fund amounts. So the March sheet has a negative general fund amount of about 33 million. And then the April sheet has a positive general fund amount. And somehow I must have, maybe I missed it, but could somebody give me a really brief answer about why that changed without me having to go through 32 pages? And the rest of us having to go through 32 pages to find the difference?
Yeah, we could. Sarah Breen shaking her head. I'm not sure. Is that for me or are you asking?
I can answer the question if you want.
Thank you. That'd be great.
That'd be good.
So the combination of the December revenue report that projected higher revenues in the general fund for FY23 than 22, that's one part of it. And then the other part of it is some of the fund transfers that we just did in LD 715.
The fund transfers. Okay. I was thinking
Between the
that I
fund
was-
transfers and the revenue report from the December Revenue Forecasting Committee. Those are the two big factors that drive that number in the second fiscal year.
But we haven't had a revenue report between March and April, right?
Correct.
So that, I wouldn't think that would change it between those two sheets. But certainly the transfers you
Yeah,
mentioned.
the transfers would explain it.
Right. Okay. Thank you.
Sorry, my apologies. Any other questions of the committee? I'm not seeing anyone, although we always have opportunity to come back and inquire with HHS about their deliberations. I certainly want to thank the HHS committee, the chairs and the leads that are here today, and other committee members. Your budget is obviously very, very in-depth and complicated, and I always appreciate the way that you and Luke and Anna and Aaron always bring to us something that we can really get our hands around and dig into in what is still complicated but a logical manner. So thank you so much for that, and thank you for all the work and conversations that you clearly had in your committee around these very complex issues in a very turbulent and interesting time in our state's history, not only with the pandemic, but just in general about where we're trying to go and where we're headed. So thank you very much to your committee for that. I know you have a lot of bills and a lot of work ahead of you. We look forward to seeing those things come through as well. And without any further questions by AFA, I will thank you again, and I will
Thank you for your help smoothing out the start. Appreciate that.
No worries. No worries. So thanks again, and we'll look forward to seeing you in the future. And that being said, I think the AFA committee is done for the day as well. So we'll adjourn today's